Today I will be performing a neuromotor, sensory, and reflex assessment. We'll begin today with doing the general questions and physical assessment, along with assessing the patient's mental status, motor functions, sensory functions, and reflexes. I'm Kelsey. I'll be doing your assessment today. Can I have you tell me your first name and last initial?
Scott L.
And your birthday?
9/28/1992.
Can you tell me the reason that you came in today?
A wellness visit.
Can you describe any difficulties you have carrying out your activities of daily living?
I usually do not have any.
Do you have any chronic disease such as diabetes or high blood pressure?
No.
Do any members of your family now have, or have they ever had a neurological problem or disease?
No.
Have you ever been diagnosed with a neurological illness?
No.
Have you ever had an injury to your head, neck, or back?
No.
Do you have any allergies?
I do not.
Recent illness?
No.
Current medical conditions? Do you have any of those?
No.
Any medications that you take?
Daily vitamins.
Any past injuries?
I broke my left leg.
Have you noticed any changes with how you walk in the past 6 days?
No.
How about in the past 6 weeks?
No.
Any changes in the past 6 months?
No.
Do you walk with a cane, a walker, or assistive devices?
No.
Do you drop things easily?
No.
Do you consider yourself clumsy?
Yes.
Do you wear a helmet when biking, skateboarding, or skiing?
Yes.
Do you wear a seatbelt in a car?
Yes.
Do you now or have you ever used recreational drugs or alcohol?
No.
Do you live in a home built before 1978?
No.
Are you exposed to any toxic chemicals at home or at work?
Yes.
Have you ever found a tick on your body or pet?
No.
Do you now or have you ever had fainting?
No.
Dizziness?
No.
Lightheadedness?
No.
Seizures?
No.
Tremors?
No.
Visual disturbances?
No.
Hearing difficulties?
No.
Changes in your sense of taste?
No.
Changes in your sense of smell?
No.
Numbness or tingling sensations?
No.
Headaches?
About once a month.
Are you having any pain right now?
No.
Do you have any trouble remembering things?
No.
Any speech difficulties?
No.
For our physical assessment of the patient with their vital signs, blood pressure 124/86, heart rate of 90, normal sinus rhythm, 18 respirations per minute, and a temperature of 97.5. The mental status of this patient and their overall appearance, they present, they're clean, well kept, and alert and oriented. Their hygiene, clean hair, no smell, clean nails and skin. Grooming, hair is well kept. Posture, they were sitting in the chair with their back straight. Body language appears interested in the assessment. Facial expressions appear within normal limits. Speech, normal movement of the tongue, lips, and jaw while they were speaking with me. Tone, they were a cheerful tone. Volume normal, able to be heard and clear. And ability to follow directions, they were able to do so. I will now assess the patient's mental status and their orientation. Can you tell me what today's date is?
February 22nd,
And the year?
2016.
About what time is it?
About 9:30
AM or PM?
a.m.
And can you tell me where we are right now?
Physicians Regional Medical Center.
Okay, and can you tell me again your reason for coming in?
Wellness visit.
Based on the questions that I've asked the patient, I'm able to tell that their short-term memory is intact, long-term memory is intact, ability to calculate is intact, they have abstract thinking, their mood and emotional status is cooperative, happy, and stable, perceptions and thought process statements are logical and relevant, and their judgment, and they are able to decide on realistic courses of actions for situations. The next part of our assessment, we will assess the patient's motor functions. First, we will assess the patient's gait. So if you can walk towards me like you normally would. The patient is able to walk without any difficulties. They are stable, not unsteady. Can I have you go back to the corner again? And can I have you walk heel to toe? Okay. Patient is able to walk heel to toe and maintain balance. Can I have you now walk on your tiptoes? Patient is able to walk on their tiptoes and maintain balance. Can I now have you walk on your heels? Patient is able to walk on their heels and maintain balance. Now we're going to try to do the Romberg test. So if I can have you stand just like that and close your eyes. Okay. There is no swaying while the patient's eyes are closed. I'll now ask if you can touch my finger and then touch your nose. So can you use your finger with your right hand to touch my finger and then touch your nose? And then back to my finger and then back to your side. And then with your left hand, to my finger to your nose, to my finger to your side. Patient is able to touch both my finger and their nose with right and left hand. We'll now assess their rapid alternating movement. So can I have you stand with your palms up and turn them over and back and over and back. Patient is able to alternate movements. Can we do one? Yep. Now we'll assess their heel to shin with right and left leg. So if I can have you run your heel up and down your shin, and then with your left leg. Patient is able to perform a smooth action with both right and left legs. Next, we'll start the sensory function part of the assessment. I'll begin by doing light touch. So when I touch your arm, and you can feel me, just say yes, okay? Can I have you close your eyes? And can you tell me what I'm touching?
You're touching my right calf, my left knee, my right arm, my right cheek, my left cheek, my left arm, my right foot.
Okay. Next we'll assess sharp and dull. So I have a pen. This is the sharp end, and this is the dull end. So if you can determine if it's sharp or dull touching you, just let me know which one it is, okay?
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Next we'll assess temperature. I have a cold ice pack and a warm cloth. So if you can tell me if it's hot or cold with your eyes closed, okay?
Okay. Cold. Hot. Cold. Hot. Cold. Hot.
Good. Next, we'll assess your ability to identify objects with your eyes closed, okay? So if you can go ahead and close your eyes and stick your hands out for me. Can you tell me what's in your hand? What type of object?
Feels like a coin.
And keep your eyes closed. And can you tell me what this object feels like?
Feels like keys.
Okay. The patient's correct. We have a key and a quarter. Next, we're going to assess your ability to identify numbers without looking, either on your hand or your back, okay? So can you stick your hand out for me?
2.
Yes. And can I have the same?
5.
Correct. And then one more.
3.
Yes, correct. Next, we're going to do 2-point discrimination. I'm going to use 2 Q-tips and touch up either your arm or your leg using the 2 Q-tips at the same time, okay? And just let me know where I'm touching you, okay?
Okay.
And with your eyes closed.
Arm.
And did you feel 1 or 2?
2. Right arm or left arm and 2. My right leg and 2. My left leg and 2.
Good job. Next we're going to identify parts of the body being touched just like we did, but I'll use my finger this time, okay? So if I can have you close your eyes.
My right cheek, my right arm, my left arm, my right leg, my left leg.
Good job. The next section of the assessments is reflexes. The scale for the reflexes is from 0 to 4. 0 is no response, 1+ is diminished, 2+ is normal, 3+ is brisk and above normal, and 4+ is hyperactive. Before we begin our reflexes, I'm going to inspect the patient's skin just by looking at it. I'm looking for lesions, and there are none present. Next, I'm going to palpate the patient and feel for any lumps or bumps, or if anything causes them pain. Next, we're going to begin with the reflexes. We're going to start with the bicep reflex. So for this, we must support the patient's lower arm with our non-dominant hand, and the arm needs to be slightly flexed at the elbow with the palm up. We need to compress the bicep tendon with the thumb of our non-dominant hand, and then using your reflex hammer or the opposite end of your stethoscope, we need to briskly tap our thumb, and we are looking for contraction of the bicep muscle and slight flexion of the forearm. So based on my assessment, this patient has a normal bicep reflex. Next, we're going to assess the triceps reflex. So first, we're going to support the patient's elbow with our non-dominant hand. Then, we're going to sharply percuss the tendon just above the olecranon process with the pointed end of the reflex hammer, or with using your stethoscope, and observe contraction of the tricep muscle and extension of the lower arm. We're going to percuss, right there. And the patient has a normal reflex. Next, we're going to assess the patient's brachioradialis reflex. So we'll begin by positioning the patient's arm so the elbow is flexed and the hand is resting on the patient's lap in a semi-pronated position. Next, we will use our stethoscope or our hammer and briskly strike 2 to 3 inches above the wrist and assess for flexion of the lower arm and supination of the hand. The reflexes of the patient's brachioradialis is normal. Next, we're going to assess the patient's patellar or their knee reflex. So first we're going to look at it here, And we're going to palpate the patella to locate the patellar tendon inferior to the patella. We're going to briskly strike the tendon with our hammer or our stethoscope, and note for extension of the lower leg and contraction of your quad muscle. And the patient has a normal reflex. Next, we're going to assess the Achilles tendon or the ankle reflex. So we're going to have the patient flex their leg at the knee. Also, we'll have dorsal flex the foot of the leg being examined. I will hold the foot with my non-dominant hand and strike the Achilles tendon. And then we'll also do the other foot. And we have normal reflexes. Next, we'll assess the patient's plantar reflex. So we'll position the leg with a slight degree of external rotation of the hip. Then we'll stimulate the sole of the foot from the heel to the ball of the foot on the lateral aspect, and continue the stimulation across the ball of the foot to the big toe. We are going to observe for the plantar flexion in which the toes curl toward the sole of the foot. It may be necessary to hold the patient's ankle to prevent movement. And the patient has normal reflexes. Next, we will assess the abdominal reflexes. So I'm going to explain to the patient that we need to expose their abdomen, and that I'll be using an applicator to stroke the abdomen from the lateral aspect toward the umbilicus to observe for muscular contraction and movement of the umbilicus toward the stimulus. And I'm going to repeat this procedure in all three quadrants of the abdomen. And the patient has normal reflexes. I also inspected the abdomen before I began. Next, I'll be assessing the Glasgow Coma Scale. So I'll do this by first assessing best eye-opening response. The patient opens their eyes spontaneously, so that gives them a 4. Best motor response to painful stimuli. The patient obeys verbal commands, so that is a 6, and their best verbal response, as we can tell from the beginning of the assessment, they're alert and oriented times 3, so their total is a 15. Now for patient teaching, I suggest daily exercise for this patient, a low cholesterol, low calorie diet, wearing a helmet when biking, skateboarding, and skiing, and continue wellness visits, along with protection from toxic chemicals at work and information on what type of chemicals and how to prevent any further injuries. And that is the conclusion of my neuromotor, sensory, and reflex assessment.